There are around 68 medications that have been identified so far that affect how your body processes temperature. For example, the condition which has the highest degree of mortality due to extreme heat is schizophrenia. And that's because of the medications that are prescribed for schizophrenia and how your body processes it. Wow. Insulin, very common medication used to treat diabetes. There's research that shows when the temperature is higher, the same dose of insulin causes a greater response. And so the preventative literature actually says your insulin dose may need to be decreased when the temperature is really high. And there's countless examples like this that have been uncovered by a number of studies, but none of it is really making it to patients, to the clinical practice. And I think what I'm particularly excited about is the potential of AI to help scale and that access to new knowledge to the people who need it, not just in the wealthiest places, but really around the world.
Yeah. Thank you for that. I mean, that's fascinating, and thank you for sharing those very concrete examples and insights. We're almost out of time, but before we wrap up, I'd love to pose a question to all of you, and a forward-looking question, which is specifically, what kinds of partnerships do you think are missing or need to be reinforced in order to carry forward the types of changes that all of you have been discussing from your vantage points? And how are you thinking about those partnerships, whether it's for long-term investment or collaboration or knowledge sharing? So Manisha, we'll start with you and we'll work down the line.
Yeah, that's a great question. And, I think we are in a moment of paradigm change. And I think when we think about the last 20, 30, 50 years, we have lived within sort of disciplinary boundaries. And now we need to shift those. So whether it is really looking at and climate and health is exactly an intersectional sort of component. So whether, as my example said, the Ministry of Agriculture is thinking about health, that's a change in mindset. Are we looking at novel partnerships between sort of the private sector, the public sector? What is the role of blended finance in really transforming how we are using different types of capital to drive some of these changes? And again, you need different communities coming together and bridging language that allow you to create those solutions and those actions. But again, I think to Chetan's point, we also need collaboration within science, because science is under threat today. It is the essential foundation that's going to get us to that future. But how do we create new science, talk about it, and make it more approachable to the average people so that they can be proud of it, trust it, and incorporate it into their daily lives? That's going to be critical.
Great.
Yeah, just continuing to build on that, I think we need this intersectionality between climate, health, technology. And also, I really believe a lot, too, in the power of patients, and patients working together with clinicians as co-design partners and really imagining the future of what we want to see in the healthcare system, and I think are often not, the voices aren't empowered and lifted up enough in communities that are often facing the brunts of climate change. And so really excited about how the healthcare system helps to lift and connect these voices.
Fantastic.
I think we believe we need system change to make this happen, and to get system change, we're not going to do it without collaboration, whether that be public, private with each other, providers and funders. We believe that is the way forward.
Fantastic. Well, thank you, Manisha, Chetan, and Nigel for this conversation, and for joining us and sharing your insights. We appreciate it, and all the best with the work that you continue to do.
And now, please welcome Cigna International Health CEO, Sebastian Osle, United Nations Under-Secretary General for Management Strategy, Policy and Compliance, Her Excellency Catherine Pollard, and Deputy Head of Mission and the National Treasury Chief Representative in Kenya's Embassy in Washington, D.C., Ambassador Christopher Kirigwa, for a conversation with journalist Maggie Lake.
Hello again, everyone. Thank you all for being here. I'm so glad we are taking the opportunity to turn our attention to healthcare workers and the workforce who are so critical in implementing so many of the things we've been talking about all day and will continue to talk about. It's so critical and probably a topic we don't spend enough time on. So thank you, thanks to all of you for focusing on it. Catherine, I'd like to start with you. As has been the discussion all week and will be, the UN is undergoing significant reform. How will those changes affect healthcare workers and those on the front line?
Well, first of all, let me say thank you to Cigna and to Foreign Policy for inviting me to be part of this event. It really is a great honor, and it's very timely to talk about these issues. So, as you know, UNGA80 is the Secretary General's initiative aimed at making the UN more effective and being able to better deliver our mandates, while at the same time we know that the landscape is going to be more financially restricted than in future than as we have had in previous years. Yesterday, as the President of the General Assembly said, our 80th anniversary is not a time for big celebrations and parties, but more a time to reflect on and how we can do better moving forward, which I think is deeply insightful. So against this backdrop, some of the challenges for us, and especially our staff, because our organizations, the largest part of our budget is staff, it is also going to be a transition period. There is a lot of anxiety because there's going to be a lot of change, whether through restructuring of organizations, perhaps merging of other organizations over time, as well as, yes, reductions in the budget will of course mean reduction in the number of positions. It means that staff may have to move to different types of functions. They may have to move to other locations where the organization is located, and sadly, some may have to leave the organization. So there's a lot of anxiety among staff in the future. I would say it does look a bit uncertain because the UN leadership is not totally in control of the final decision making. That's in the hands of member states, and it's difficult to predict at this point exactly what those outcomes will be. The one, I would say, inevitable outcome we know is that there will be change. Exactly what and when, we will know later on in this year. So I think we have to really expect that we will have to be more alert to the issues that will come up with staff from this level of anxiety and emotional distress. Mental health support is an issue that we are now much more, I would say, cognizant of and sensitive to, especially since the years of COVID, when before that, no doubt those situations existed, but it was not something that we talked about. So really being able to provide the support to the staff that they will need and their families, because for every change, it's not just the staff member, you're also looking at families and livelihoods. And for those who are perhaps going to move to another location, what happens to me, what happens to my family, where do my children go to school, what healthcare services I get is really very, very critical, especially if they've been in their current location for several years. If they move periodically, it's less difficult. It's yet another move. But if you've been in a location for 10 years, 15 years, and then you have to move somewhere else, it's like stepping into the unknown. Yeah. So sensitizing managers and leaders who also have to understand that these are issues and to be able to be sensitive to them, I think is one of the challenges that we have. The good news is that we have a mental health strategy, and we have a lot of engagement, and of course with the key partners that we have like Cigna, how we can continue to improve the services that we provide to our staff.
Yeah, periods of disruption are very difficult. I think this is why it's so important to actually focus on this issue, and I appreciate your candor with that. Sebastian, your recent work highlights alarming levels of burnout. So we're talking about this disruption on top of what is already a very challenging, difficult job fraught with mental health challenges and burnout. How are you thinking about this, and what role can innovation play? Because I know everyone here is solution-oriented. What role can innovation play in addressing this?
Yeah, if you allow me just to also set back and set the scene from a couple of angles and build on Catherine's really important points. Most of the UN missions is people-powered, right? So delivering on these critical missions means that we have to have an engaged staff. And here we are creating a disruption. The second aspect is duty of care. One of the components of duty of care is providing access to care wherever the staff is located in the world. And here we are not talking about New York only. We are talking about Somalia. We are talking about Bangkok. We are talking about many, many areas in the world. So thinking about supporting the staff during this disruption is quite a significant challenge. In addition to that, duty of care does not stop at the level of active population. We are talking also about a retiree population, which puts an elevated pressure in terms of cost of care and support and budgets. Because when you look at the trends in terms of cost of care, we are talking about double-digit trends every single year, which outpace by a margin any GDP growth you can think about in any developed countries, which means that we do see a pressure in terms of the cost of duty of care while having this pressure from a budgetary standpoint. And actually, this is at this very moment, we are creating a distress situation for the staff for which we expect more. So thinking about, and this does create a space here for innovation because the status quo is not an option anymore. We really need to move forward. So here, there are a couple of initiatives. So Catherine talked about mental health. There is an opportunity to expand because sometimes we are more on the reactive side. And science tells us that if we roll out the right preventative programs, for $1 we invest in prevention, we get a return of $4. This is WHO research, which is interesting because we are creating almost a very strange dynamic here because we are talking about investing where we are talking about budget cutting at the same time. But these are the bold choices which has to happen in terms of how do we create the emergence of thinking out of the box, developing new preventative program. The second dimension is empowering individuals to navigate in their own healthcare system. Digital experience is one of the avenues. We are now developing symptom checkers, telehealth consultations, promoting all these vehicles which empower the individual to navigate through health care systems, empowering individual to take care of himself or herself, and creating a path towards more affordable solutions. And all of that has to be developed in a framework which has to be agreed within the international organizations because there is a change which has to be managed. There's an engagement which has to be happening with the staff. And this is hard work, but I do believe there is a path forward to create a support framework for the staff and their families, but also an affordable path for the budget of these international organizations.
This is where data matters, right? Because you can talk about cuts or you could talk about smarter spending that saves you and come to the same conclusion, but it matters, at what point you intervene. Ambassador, I see you nodding your head. You've actually had to enact major reforms in your country's public-private partnership. So you've walked down this road to a certain extent before. What lessons can you share from your experience?
First, thank you very much for both Cigna and PF for arranging this forum. And it's a great morning to be here during the United Nations General Assembly, where Kenya made the national address today. One big aspect we look at is accessibility to healthcare. It's critical. It is not. It's not a luxury, but a necessity that the government has put to ensure that everyone can get access to good healthcare. In Kenya, what we did is we looked at some key reforms that the government needed to make to ensure that healthcare is accessible to many more. One key aspect we did is that, first, number one, the biggest challenge to getting good healthcare is actually financing, and also funding to ensure that everyone can be able to, either the government contributes a little bit, individuals contribute a little bit, or creating innovative financing models that can enable people to access good healthcare. Now, that's not an easy task. I was privileged to listen to the previous panel. One key aspect that we need to look at is blended finance. And in Kenya, what we did is, when we created the new PPP Act of 2021, we looked at how do we balance the risks between the private and public. So in insurance, you need to go even much more further. You need to look at actually not just the public as holistically, but actually individuals. So just recently, the government actually put in a new social health insurance fund, where every individual actually contributes to the access of, to pay for their healthcare. So people who are less privileged are able to get healthcare, but at the same time, the privileged individuals do get good healthcare. That's not difficult. Yeah, and listening to the engagements about, especially looking at UN is moving a lot of stuff to Kenya. Kenya actually offers very many good healthcare facilities. So it's not, and I can say this, it's not any. I've lived in Dubai, I've lived in Europe, I've lived in the US. Actually, this is my second time to move to the US. We do not offer anything second to none. We actually offer very good healthcare spaces. So when staff are moving, like, for example, to locations like Kenya from the United Nations, Cigna is actually significantly big in Kenya. So we have global healthcare companies that are in Kenya, but Kenya also has a very big skill set of the skill levels in Kenya are very high. So I would say that government has done a lot of work to put reforms whereby we create blended finance solutions to fund for healthcare. For high-end, for like UN staff, it should not be a challenge. But for the basic common man on the street or lady on the street, the government has put reforms whereby the government contributes some funding for them to access healthcare. Individuals do contribute some funding for healthcare, but equally, the government is also putting a lot of reforms to scale up infrastructure.
Yeah, and of course, part of that infrastructure is the workers, the very talented and educated healthcare workers that you reference. Catherine, how do you balance the cost efficiency with the need to invest in people? Because especially when you're going through reform, there is an effort to get those budgets into shape, but you need to make the investments in your people. How do you foresee balancing that? What are the challenges, and how are you framing that, especially when it comes to mental health and continuity?
Well, I think overall, in terms of how UN budgets are structured as of now, I would say on an average, it's about 80% are staff costs and non-staff costs. So as part of this reshaping and realignment process in UNGA80, I think one of the outcomes will have to be a larger, better balance between staff costs and non-staff costs. Today we are 80%, perhaps we need to move towards a ratio perhaps more of 60-40. That takes time in terms of the numbers of positions. I think that will create more flexibility for the organization to have resources to be able to invest in our people, in healthcare support, as an example, because as I would say, in maintaining the current level of excellent care that we have, and let me say that as UN staff members, we do have an excellent level of healthcare support, whether we are here in New York in headquarters or in other stations around the world. Not only for our currently serving staff, but also for our retiring staff, which is a cost factor that we have to look at and constantly do have to look at, because part of the I would say the pact of the organization with our staff is that they give their service for many decades, sometimes in some of the more difficult places in the world, with the promise of a comfortable retirement, which also comes with an excellent level of health care, which is not always available back in their home countries because they have been expatriates and worked for the UN for so many years, regardless of nationality. So that's, I would say, the pact of the organization. So how do we manage that going forward we know, the global health industry with the costs constantly rising, but maintaining that commitment to our staff? So I think there are a number of tools that we will have to manage. We'll have to look at, for instance, the structure, without compromising the level of care, but the structures of the plans themselves to provide that level of care. And how do we better use, for instance, technology in terms of access to care? Because for us, the guiding principle will be the level of care that we provide. It's part of our commitment to our staff, and the access to care, as you mentioned. I think those are non-negotiable. It's part of what I call the compact with our staff, and we want to maintain that. But we know that, yes, finances are going to be more challenging as the years go by, but I think, again, to be able to have more flexibility between the staff part of the budget and the non-staff costs in the budget will give us that kind of flexibility to be able to make those investments, not just in healthcare, also in learning and technology and all the other tools that our staff will need to continue to be able to be mission-driven.
And Sebastian, I think this is where the opportunity is. First of all, once again underscores the need for a partnership, for public-private partnership, especially leaning into those technological innovations. So what are you focused on that can help maintain that continuity and that standard, but at the same time make sure that the healthcare workers are getting what they need?
Indeed. Just to build on your point, Mr. Ambassador, I visited Nairobi hospitals and the sites where we have the UN staff there, and I can really confirm that Nairobi has become a major center of excellence in terms of access to care. So access to care it can't be compromised, but there is a triangle in terms of duty of care. You have access to care, quality of care, and cost of care. The point is then, how do we innovate? Innovation is not only technology. Let me give you a couple of examples. One is, how do we nudge, how do we encourage, how do we incentivize staff members and their family to go to the right providers in terms of cost of care versus quality of care? Can't be an open bar forever. And cost differential between one hospital to another could be significant. That's a difficult discussion, but that's trade-off which could be happening. The second one is developing a set of clinical programs. We know that chronic disease, specifically for the retiree population, is rising significantly, and it's a big part of the budget. So how do we create more support in terms of MSK, cardiodiversity, mental health, which could, in the longer run, contain costs? Return to work is also something which is important. We've noticed during the stress period that staff members could be more absent. And the moment we leave these people leaving the organization after 2 or 3 weeks, it's very difficult for this individual to reconnect with the organization. And if you lose this sense of purpose and connection, we are losing a lot of value. And that's where we can be much more proactive in connecting with an individual who is out of sick to develop a strategy to come back to work in a positive way. And the level of satisfaction we've seen through the people who volunteered in some organizations is amazing, meaning that people feel that they are actually supporting these tough times. Because it's not an absence of willingness, it's more people being in a challenging position. Absolutely. And of course, technology is playing an important role. AI, symptom checkers, triage in terms of how do we nudge people to telehealth consultations, which we know is much more affordable, and up to the navigation through health in complex ecosystem we can automate and again empower the individual to make the right trade-offs.
Yeah, all great examples and a fantastic illustration of pulling in private sector examples, things that have happened in the private sector put them into place in a situation like this. Ambassador, can you talk a little bit about, having put through that reform, how governments can structure PPP reform to make sure that you're not just looking at the healthcare infrastructure itself, but also the workforce?
I'll start here by engaging about the first thing is about commercial viability. It's very important, actually, when you talked about access, quality, and cost. It all comes down to funding. The first thing that we need to look at to ensure that you increase access is to drive right financing models. So you need to ensure that, because someone has to pay for it. That's at the end of the day. Yeah. And what you need to look at is how do you make it as cost effective and affordable as possible. One new element that's emerging very strongly is leveraging on data and AI. It's very critical to reducing cost of healthcare. The challenge that has been there is healthcare data has been so held in such secrecy that completely locks out driving new efficiencies to leverage on AI and on data. So you look at, for example, let's talk about Cigna. If I want to go get a cover from Cigna with no health data, they will price me the highest because they have to protect and price the risk. But if Cigna had my health data at their fingertips, they will able to price me based on my health. So I mean, my health conditions. Yeah. So what happens, what you see around the world currently is, and markets without data, everyone, a company like Cigna has to price everyone at the same level. Yeah. So access to data and creating data privacies and solutions to make sure that health data is available is a very key reform that's required. Not just in Kenya is working on that, but it's required all over the world. Yeah. The second one is about what you talked about, the reforms to ensure that you bring in the public and private. I think that's not the easy, that's not the difficult part, because for Kenya we took about 1 year to create to get the law to pass through legislation, and we got it into place. And once we got the law into place, we're able to do quite a number of healthcare PPPs, yeah, which goes to the accessibility. But my last point to this is, when you talk about accessibility and also quality, accessibility comes through financing, but quality should not be anything that should be questioned. It's almost like saying quality of a pilot. We cannot question the quality of a pilot. Same to healthcare. We should never question the quality. So whenever we're offering healthcare solutions, we look at providing the best healthcare solutions, and that's why I talked about Kenya offers second to none. Thank you.
Thank you so much. We're out of time, but this is such an important discussion, and I know that quality is front and center for all of you. So we appreciate your work on this very important change that's going through. So thank you so much.
Thank you.
Thank you.
Please welcome Merck Executive Vice President and Chief Human Resources Officer, Betty Larson, Unilever Chief Health and Wellbeing Officer, Dr. Diana Hahn, and Mercer CEO Stephanie Penner for a conversation with journalist Stacey Samuel.
Hello, everyone. Great to see you here. And thanks for being so committed. It's Thursday, and there's still a lot to go, and so many important conversations to be had. So we're here. It's Wednesday? Oh, I'm a day ahead. You've got an extra day. I give you an extra day back. So all the more reason that we can really focus and pay attention to the vital conversation we're going to have here today. The question being, what role should employers play in advancing cancer prevention and early detection for their workforce? The reality is stark. Cancer cases are rising worldwide, affecting not only the health of employees, but also their families. And obviously the productivity at work. At the same time, research shows that employees trust their employers more than governments or even doctors to provide access to affordable, quality health care. That puts business leaders in a unique position and an urgent one. So to help us unpack this, we have three leaders who bring complementary perspectives from human resources, global benefits strategy, and corporate health and well-being. So thank you, ladies. Betty, I'm going to start with you. You've said that prevention and early detection are both a responsibility and an opportunity for employers. From Merck's perspective, what's the strongest case, both human and business, for investing in preventative care for your employees? And what is the business case for investing in cancer prevention and early detection from an employer's perspective?
So first of all, as a large global healthcare company that aspires to make a difference in the battle against non-communicable diseases and conditions like cancer, we feel a responsibility both as an entity and as an employer. But we have 75,000 employees around the world and are committed to preventative care because we think there's an incredible business case economically, but there's also a very strong human business case as well. And so if I build off where you started, we know that 61% of the world's population are employed. And so that already puts employers in a position where we can play a tremendous role to drive access to preventative care, as well as to create an ecosystem that encourages preventative care. Like many of the employers participating, cancer is one of the most significant rising costs in our healthcare plans. And we appreciate that in providing access to screening, providing access to vaccinations, creating an ecosystem that values wellness and encourages people to take the time they need to engage in preventative care pays dividends, either in avoiding future costs down the road in our plans, because we know it's much more expensive to treat a condition than prevent a condition, but also in the time that's lost in absenteeism, time off for treatment, and then the impact to the family. So we think there's both a human case as well as a financial case for preventative medicines and measures.
So you've highlighted why prevention matters so much. So let me ask you a follow-up, because you've also stressed that it has to be easy and acceptable for employees to take time for these screenings. What are some of the practical steps that you've seen employers take to kind of remove some of those barriers, whether they're stigma, logistics, access?
Yeah. And look, first and foremost, we're a company engaged in cancer care, and at the same time, this isn't easy. And so there's a stigma around asking for time off to engage in preventative care. Certainly there are benefits that we've put in place to try to encourage and promote preventative well-being. But, some of the tactics we've seen other employers engage in, and we're certainly open to learning from others and learning with others, is, we've participated in a number of public initiatives and pledges. Most recently, so we've been engaged with an organization called Publicis. They have a global initiative around working with cancer. We've more recently joined in on their initiative around time off for screening. And so we've made an open pledge to all of our employees around our desire to have them take time off for screening. We're working with all of our plans around the world to create not only the incentives, but make sure that whether it's government-provided benefits or through our benefits, that preventative screening and vaccination is available to them. And so it's really breaking down those barriers, both from a programmatic and policy perspective, but also something as simple as we were talking backstage. I talk openly with my team about taking time off to go do a wellness screen or an executive physical or whatever vaccination might be. It might be time for through the year. Our executive team made a video to demonstrate that they were engaging in a preventative vaccination campaign. And so I think just the more we can role model and make sure the environment supports preventative care, the better.
Okay, so that's a great setup, and I see Stephanie shaking her head. Okay, so Betty made the case for the why and has given us a sense of the, the cultural and logistical challenges and how to overcome them. So Stephanie, let's turn to the what. From Mercer's research, what are you seeing in terms of employees' biggest concerns, right? And why does shifting the focus to prevention make sense for both employers and employees when it comes to building a more resilient workforce?
Yeah. So let me tee up my response to that question by saying this. People, including everyone in this room and everyone that's watching, people have never been more aware of their future selves than they are today. There are apps now that will show you what you will look like decades from now, right? And while that can be unsettling, it can also be inspiring, motivating people to take action. And interest in wellness and preventative care is at an all-time high. And how about this statistic? I know you're not going to believe me, but it's true. 46% of employees say they would give up a pay increase for more wellness benefits. And employers, and we've talked, are listening and they're responding. They are designing or redesigning their benefits strategy and programs to look at more holistic health, because employees not only expect their employer to support them in their healthcare needs, but like you said, they actually trust their employer to help them on their entire healthcare journey. And it is a journey. Yeah. And it starts with the communication, the education, awareness, the role modeling, the prevention, diagnostic treatment, even post-treatment. And so employers really have a responsibility in that entire healthcare journey.
Okay, so then the follow-up is, how should employers translate that trust into concrete action on cancer prevention and early detection?
Yeah, well, so our studies show that 80% of employees would be happy, if not thrilled, for their employer to educate them on preventative measures. And yet, less than 50% of employers spend time on that part of the journey. And so while that might sound shocking, there's just a huge opportunity there to step into the early stage of that journey. And what we also find is that when you look at differences by generation, the Gen X and the boomers, so like age 45 and above, they really want that preventative care support. And look, that's the backbone of our workforce right now. Mm-hmm. So those are just some ideas.
Oh my goodness. You know, and when we think about translating these opportunities to organizations like yours, Diana, that service, you know, employees in 190 countries. Betty and Stephanie have now shared, you know, the why and the what. How? Let's look at the how. At Unilever, you're responsible for employee well-being across all of these countries. That's most of the globe, many of which have varying levels of healthcare infrastructure. How do you make preventative care and whole person well-being accessible to these varied, you know, constituents, if you will?
Yeah, I think picking up on the points that Betty and Stephanie have shared, first of all, I think it starts with trust. The how has to start with trust. And for Unilever, as with other employers, I think the journey of trust was actually quite interesting from the COVID era forward. And really, I think having to be much more involved as an employer on the access piece when we operate as globally as Unilever does, because that 190 countries is a literal, not a figurative number. And of course, health system capability, societal infrastructure, very different around the world. And as an employer, we have the both literal and figurative proximity and intimacy with our people. And we have the ability to have conversations every day and build upon the trust to, number one, exactly as Stephanie has said, raising awareness, educating around prevention. In this case, we're talking about cancer prevention, but cancer prevention is not just about things like the cancers themselves that people are trying to ward off, cardiometabolic health, healthy weight, lifestyle. These are all things that are incredibly relevant for cancer prevention. So in other words, whole person health. There's a physical component, there's a mental and emotional well-being component, there's a role of stress, and all of these things come to life in the workplace because human beings bring all of themselves to work. There's not some artificial line, this is me at home and me at work. So raising awareness, educating about the incredible importance of prevention, why prevention matters. And the thing is, motivation for sustained health behavior change is very different person to person. So we never talk at people. We don't lecture. We don't get into values because every human being will only change when there is some motivation that is so important to that human being. It's very different for me than it is for you and than it is for you, and so on. And so it's a very specific approach to raising awareness and educating on risks, lifestyles, and broadly opportunities. So that's the first point. The second point is reducing physical barriers to accessing preventive services. So at many of our sites around the world, we operate on-site health systems. We also complement this with virtual health services, or both. We also have roles that range from physicians, nurses, allied health professionals operating at many of our office and manufacturing facilities around the world. So we can complement the services available through traditional health systems, which are often quite overburdened around the world. So we can do our part as an employer there. We also navigate. So there's aside from the physical facilities, really important is the care navigation, because as an employer, we cannot possibly provision every resource that is necessary to support health. There will always need to be an interplay with the community. So we can help with the navigation, which can be very complex, no matter what country of the world we are operating in. And so more broadly as well, taking a step back to a lot of the points that Betty has made, so there's a policies piece, there's a benefit design and designing to prioritize high value services and raising and lowering, I should say, the financial barriers to accessing those services is another part of the how for an employer. So it's all of those things, I think, put together into an ecosystem that at least that there's a continuous improvement loop, there's an engagement loop. That's really where things have to start and continue.
You know, can I just pick up on something? So I feel like, and it's something that we were talking about, I think the importance of personalization and that there is no one size fits all in terms of determining healthcare solutions and strategies. And you just gave some great examples. But when you look at global variations around the world, you have to look at things like gender and age and just even the local or cultural differences. I mean, in India, where I'm traveling to on Friday, 79% of the workforce are caregivers, versus in the US, it's like 43%, something like that. So very different needs. So whatever you're doing, there needs to be an appreciation and adaptation to fit those needs locally.
I do think you both are hitting an important part. I mean, for us, part of the unlock is we have to think about not only the employee that we have a relationship with, but their family as well. And so where we can, you know, we are working hard to make sure that that access and information is not just for the individual we have an employment relationship with, but the family that supports them day in, day out. We also recognize they spend the majority of their time with us. And so to the extent that they can be productive in that time, to actually use some of that time to access care or education is important. So I think this stepping back and taking a bit of a broader perspective, using data, to your point, when we do roll out a program to say, why are people still hesitant? Where might this be resonating, not resonating? What can we do differently is important as well. So it really is that broad and continuous commitment to driving a healthier workforce and community.
So in addition to acting as sort of a front door for your workforce, employees, and their families to have access to resources, it looks as though this needs to expand, right, beyond the commitment that your organizations, and you each represent very different organizations. So looking ahead, prevention is still obviously very challenging. You've all found ways to expand it, but for even for a large healthcare company like yours, what partnerships or innovations do you see as most promising to help employers close that gap in prevention and early detection worldwide?
I would say, as Betty has pointed out, I think what employers, the community of employers should know, and we represent actually fairly jumbo employers. So I would really want to call out that prevention is something that an employer of any size, even very small, mom and pop shops, for example, of 10 employees, it's possible no matter what size you are, including for small and medium enterprises. And I think the most important point, you don't have to reinvent the wheel. There is an incredibly rich evidence base that exists out there, readily and freely available, and a whole set of communities that any employer can dock into. So similar to Mark, we also partner with Publicis. I sit on the board of the Business Group on Health, which is the largest coalition of employers in the world. We represent 60 million lives. On our website, Business Group on Health, so many resources that can be downloaded, white papers, toolkits, and I think the key is you're not alone. None of our companies is alone, and we can absolutely leverage one another. It's why these conversations as well is really, really important. So many best practices out there that can be leveraged.
Stephanie, if you had one concrete, bit of action for other employers, what might it be?
It's interesting. Years ago, the questions that we would get from our clients were primarily around what's everyone else doing. And now, while benchmarks are absolutely critical in being grounded in data, there is a growing need around understanding what do our employees want and need, and really gauging the not only the direct needs of the employees, but the perceptions. Because sometimes they perceive that the healthcare assistance is not there when it really is. And so understanding where what the employee population is perceiving and wanting gets layered into the benchmarks and is used as an input to understand where is the strongest or most impactful intervention in this process.
I mean, I keep coming back to when I think through statistics that we know and understand that 40% of cancers are preventable. And then you think about the fact that when somebody does get cancer, 25% of survivors leave the workforce. We have a shared responsibility to keep as vibrant a workforce going, whether they work at a healthcare company, whether they work for Unilever, whether they work for a public institution. There's a responsibility that we have, because when people leave the workforce or they have to be a caregiver for someone in their household that might be suffering from something like cancer, it impacts our ability to do what we need to do. And so I think there's a shared responsibility, and we can learn from each other. So we might use Mercer data to understand what are some of the most effective preventative measures that are out there. We might work with company partners to learn from what you've been able to do in countries that we're still having a hard time cracking through. And so I think it's through forums and dialogue and discourse and sharing of good ideas that we can certainly make a case. And I do think there's still a hesitancy for too many people around the world to feel like it's okay to ask for time to leave the workforce when they're healthy and access these preventative measures. And so the more we can make that the standard expectation, the better.
Please.
I was going to say, just what in the past 2 years, 79% of employees have delayed seeking health care in some form or fashion. Yeah. And so when we ask employees, why is that? There's no one answer. You might think, oh, cost. Set that aside. There's a whole host of other, getting the time off, making the time, thinking you can solve it on your own or with ChatGPT, or getting advice from friends, or just not viewing it as it's not time yet to do that. And so, or it's really difficult to navigate. I don't even know where to go, so I get paralyzed and I'm not going to make any progress. And so when, you rattle off all those things, employers have a huge opportunity to inject themselves in any one of those barriers and say, we can help with that, whether it's adjusting a schedule for time off, giving more protected time off, and that's not the only thing, helping to navigate better, helping to even understand, and like you said, role modeling. It's for everyone. Preventative care is for everyone.
Diana, you talked a little bit about navigating for your employees because, again, your employees span the globe. Are there any programs at Unilever that has helped increase access to your employees?
Yes, so we have formal care navigation assistance for our employees, and it will look different in 190 countries because there's certainly no monolithic global capability for this. But whether it's through outsourced partnerships or whether it's through our own teams that are actually delivering the care, particularly in the developing parts of the world, we make sure that their employees and also their families as well can ask the questions, can actually bridge the gap between a recommendation. Okay, you are this age, you have this risk profile, this family history, and all of the other risk factors that we assess through our whole person health prevention programs. And then bridging that from, okay, now you know, but who do you go to? What benefits do you have to support, of course, the care-seeking services? Those are all things that we help provision for our employees through different partnerships or delivered in-house around the world.
Betty, I might just give you the final say to sort of help wrap us up, but clearly you are all very passionate around providing access to health care, not just for your employees, but for their families. It creates stability and making it easier for people to just engage with preventative health care. So with that, I just want to give you the opportunity to say ultimately, what is the objective for the work that you're doing and in sharing that broadly?
Look, I think right now across the world, there are a lot of big problems that companies and individuals are grappling with. Yes. This is one that we clearly can do something about. And so as employers, as individuals that come to work every day who want to make a difference in the lives of others, this is a very concrete, actionable space in which we can make a meaningful difference in the lives of so many others. And so to the extent that we can work together, learn from each other, challenge each other to get better, to encourage people around preventative care, I think that's what I'm hoping to inspire her. And again, at Merck, we don't have this figured out yet, but we're willing to work with anyone online or in the audience that wants to help crack this.
Continue relying on the data like Stephanie provides.
I've already learned today from my colleagues up here, so that's a great example of how we can keep this going.
Well, I want to thank you all for the work that you're doing, for sharing how we can all work together. Thank you.
Yeah, great. Thank you.
Thanks, everyone.
Please welcome back to the stage FP's Andrew Solinger.
So that's a wrap for the first part of our health forum. I have so many different notes here on things that I learned today, but I will spare you because we've been here in the room for a while. Just generally, I would say that stronger health systems depend on making everyone's health business, from governments to communities to the private sector, health business. That needs to be their business. That's what they're doing. And I think that there were a lot of different and interesting discussions around here, from NCDs to mental health to how businesses can react, to how we can restructure using data to inform our flow. So really fascinating stuff. I hope you learned as much as I did. I want to thank you for staying here and being in the room. And I also want to thank the Gates Foundation, Merck, the Rockefeller Foundation, and our supporting partners, AstraZeneca, Bupa, Cigna Healthcare, and Seed Global Health. We have a ton of programming going on this afternoon. We have a part 2 that'll start in about half an hour, 45 minutes. We have some light snacks outside. Come and join and chat. But please do return afterwards. We're going to actually clear the room and clean up a little bit. So bring your stuff. and head outside, and we'll come back at about 2:30 to start the next part of our program. You can exit out of either door, and we look forward to seeing you in a bit. Thanks.